A collapse in health system resulting in overcrowded hospitals in sections of Guyana's neighbor to the south is a major cause of concern for local residents since breaching entry protocols between Guyana and Brazil is still quite possible considering the porosity of the borders. Despite continuous strenuous attempts by the joint services to curtail illegal entry into Guyana in recent months, there still lies many loopholes which could allow Brazilians infected with the new COVID-19 variant to easily gain entry into Guyana. This was disclosed by Health Minister Dr. Frank Anthony on Wednesday.
While we have heightened our presence on our borders through the joint services, if people really want to slip through, I think there are possibilities of that happening.
Some of the precautionary measures taken by local health authorities to keep the virus at bay include the closure of the land border and the recent suspension of flights to Brazil. However, trade is still being facilitated once weekly under strict COVID-19 protocols. Minister Anthony noted that the Brazilian authorities have also deployed officers to man the borders.
This has been happening for more than a month now, and that's because we have been in talks with them, and we are very pleased that they have also increased the patrols and so forth that they have on their side.
While pregnant women and nursing mothers have not been listed among the priority groups to be administered the COVID-19 vaccines, once they become available, Health Minister Dr. Frank Anthony has announced that those desirous of being inoculated would not be denied.
It's a personal choice if they want to do that, and with many of the clinical trials that have been done, they haven't had a large population of pregnant women or women who are nursing their babies in these studies. So definitively, we don't have that data. But the types of vaccines that are being used, the platforms that are being used, it is not anticipated that if pregnant women receive the vaccine or women who are nursing their babies receive the vaccine, that there would be any adverse effect.
Nonetheless, the World Health Organization has indicated that even though pregnant women are at a higher risk of severe COVID-19, it would not recommend that they be vaccinated due to insufficient data. The WHO further pointed out that in a case where a pregnant woman has an unavoidable high risk of exposure employed as a health worker, vaccination may be considered. Temika Rodney reporting for the HGP Nightly News.